it's the Rawsome Vegan Gal here, and I have an update again. I did a follow-up to my 100-day experiment using Xylitol, and I mentioned there that if I see any changes once I go for a visit to get my teeth cleaned, that I would do another video, and there has been some significant changes that I wanted to talk about regarding that. So I just want to thank Josephine, who is the dental hygiene student that I'm seeing in San Diego at the Southwestern Dental College in National City. So if any of you need your teeth cleaned and you get an exam and x-rays and all that, they do that for free. You go and see a student. So I will find the link for their site so you can find out more information if you do live in San Diego. I want to thank her. So what differences did I see? Now the products I'm possibly attributing it to, because I haven't used them before for an extended period of time, is one of them was this product called Xyla, which is xylitol, and I'm taking that every day. I take a whole packet, which is like this, and I've talked about it before, and after I eat something, I take a little and kind of break it up in my mouth. It's granules, and then I swallow it. And I also been recently also drinking a little bit of water after I eat to get out the acids, because the acid is what causes cavities. And I'm actually going to be doing an extended experiment where I'm going to be using some natural things that help re-enamelize your teeth, and also so you know they're healthier and help with the gums. And I just want to show you up close my teeth, how nice and white they look, because Josephine just did a great job. She did the polishing, so they look really good right now, and they won't stay like this forever. I wish I could get them polished maybe once a month. I'm more into that. So just so you see what they look like right now. So the other product that I've been using consistently since July, this I've been using since May, the Xylitol. This brushing rinse that I've actually done a review in a video on oral hygiene. And this one is supposed to also help give you healthier gums. And the person who created this product, Mystica, she had periodontal disease, and it helped reverse her periodontal disease. So definitely these two products I think made a big difference. The reason I know is I don't think when you go to a dentist they actually do probing, but when you go to a hygiene clinic, when there's students that they're being tested, they have professors that check everything they do, and they have to do this, then they do something called probing with a probe. And what probing does is it measures the depth of where the bone is from the top of the gums to the base of the pocket. So like, if I show you my teeth up close, if I can get you see, they go in, and you see if you see like the gums receding, then that means that there's some bone loss. So you see that the gums are pretty tight. So the idea is they go down to see how low it goes with the probe. And the probes can go up to 12 millimeters. It's not a lot. But so that's important to know. So why is this important? Because you can have inflammation and or bone loss. So what it is when they go down with the probe, it has just little parts that tell you how deep it goes. And if the number is higher than 3, that means inflammation. And if the number is higher than 5, that's bone loss, or what we call periodontal disease. So when you do have I'm just giving you some background I think is important to know. So if you don't clean them properly, then inflammation starts eating away at the tissues, and there it eventually gets to the bone. So what's called gingivitis is inflammation of the gums. That's puffiness. So that means what happens is that the gums are getting puffy around, but they kind of they dip lower than what they are when I showed you here, how they're nice and firm, and so you don't have a tight contact around the tooth. So just for you to know a little more information, so when you have bone loss, which is called periodontal disease, it's called periodontitis, which results from gingivitis. So the fact that you first have inflammation, then that can lead to that, and that's a disease because the gums are now infected. So the way to help with this is, there's two things that form on your teeth. Initially, you have something called plaque. Plaque is the soft bacteria that builds up that you can brush or floss away. So it's important that when you brush, and I have a toothbrush right here, that you brush properly. You want to make sure that you're angling it, especially down here, you're angling it down towards the teeth at a 45-degree angle, and make sure you're feeling it. And up here, you're doing it upward. Make sure your teeth feel it. So this is an upward. Okay, so you have to make sure you're brushing and then flossing properly. That's also important that you floss, and I'm not going to demonstrate it right now, but I believe I've done it before, where what it is, you make it like a C shape, and you go up and down. So back to my explanation here. So the plaque is the soft bacteria that builds up that you can brush or floss away. Now, once that becomes mineralized, meaning it forms like hardened, it becomes hard, then from the minerals in the saliva, then that becomes calculus. So what's calculus? Calculus is what needs to be removed by the hygienist. Calculus is like, it's harder stuff. It's like it's stuck on the tooth and it has to be removed. So the idea is, if you get it at the plaque stage, then you're actually helping yourself from not having that build up. So that's important to know. So what I wanted to share with you now that I gave you a little dental history, thanks to Josephine again for helping me get that information. So when she did the probing, she copied this for me, the difference in my charting of my upper teeth and my lower teeth, from the front part and then the inside. So the front is the facial and the lingual is the inside. So the upper arch, which is the maxillary. So I had some 4s. Now, anything above 3, I told you, is inflammation. So back in 2012, I had a 4. I had a few 4s. And then I also even had back in March of 2014. But those all changed. So all those 4s went down to 3s. That's significant. And one of the 4s went up and down a little, 2 to 3, 2 to 3. So I didn't have as many 4s, or I had, let's see, 1, 2, 3, 4, 5, 6 of them. But some of the numbers went down even lower. Different parts. There's 3 I guess, areas that they do on each tooth. So there's 3 numbers. So now for the lower, which is the mandibular, I had most of mine were on the lingual, which is the inside of the teeth. I had most of the higher numbers. The facial, which is the front of the teeth, I didn't have as many 4s. So same thing on the lower arch, but some of those changed really significantly. One of them went from a 4 to a 2, and a few of them actually went from a 4 to a 2. So that to me shows, and that was also 2012. I had a few, and then 2014 also. Not a lot, but a few here and there in different teeth. Most of them were more in the back, in the premolars. So that's for me to realize that I have to work better there. So the thing is that now when she stuck the probe in, it didn't go down as deeply. So that shows that there's less inflammation. Now this is something we can change, which is great. So that's why I attribute it to these 2 things, both the xylitol and the brushing rinse. And of course, if you're brushing properly and flossing properly, that's going to help too. But these products are helping so that the bacteria doesn't build up. And also to increase the health of the gums. So I think that's really significant that you know this information, that I actually have proof that the gums actually are tighter now. There's not as much where the pocket is, where they probe. The depth doesn't go that low. So that means they're healthier. My gums are healthier. So I really thought that was very important to share that. I attribute it to that. I don't know if I'm brushing or flossing really that much differently, but I really feel that these products that I've used consistently, every day, I'm getting difference. And the brushing rinse I use twice a day, so I'm feeling like that really made a difference in what is being shown when Josephine did this probing. So I thought that was really pretty awesome for me to have that information, to know that there's a difference. And I may actually also write up something on my blog and then show a picture of the probing depths for you to see the difference. I thought that was really significant. So, and I will link the products again below this video so you can look into getting them yourself and hopefully have improved teeth. And again, I'm going to follow up. Like I said, I have another experiment I'm going to do, and I'm going to take pictures of my teeth and show some of the difference with the gums, and then show how I can progressively transform them and hopefully re-enamelize them. But again, here's my lovely teeth. I want you all to see them again, how nice and clean they look, and they look much whiter and brighter thanks to Josephine. I just wish they could stay this way. Maybe if I didn't eat ever, if I just drink water. But that's not a possibility. But I want to thank Josephine again for all her knowledge in helping me, and seeing these great improvements to my teeth with probing. So this is the Rawsome Vegan Gal, and thank you for watching.